I'm Irvin Waller, Emeritus Professor of Criminology at the University of Ottawa in Canada, and author of Science and Secrets of Ending Violent Crime, and also author of a book on smarter crime control. I think this is a very exciting time for us with some important challenges. In 2015, all the governments of the world agreed to some sustainable development goals. Yes, about the environment, about reducing child poverty, but importantly also about reducing street violence and homicides, violence against children, and gender-based violence. We're living in a time when we have very solid evidence about what has worked. And what has worked to reduce violent crime does so by focusing in the areas of concentrated poverty and disadvantage, but looking particularly at those families and children who are most likely to be involved in multiple acts of violence and property crime. And what we know is that if we focus on those young men, we can reduce violence by upward of 50%. For instance, the youth inclusion programs in the UK reduced arrests by more than 60%. We know that an important Canadian program called Stop Now and Plan, that is a cognitive behavioral program to change the likelihood that young men will engage in violence, reduces violence by more than 30% with a cost benefit of $35 for every dollar invested. We know also that positive parenting programs can reduce violence. Yes, they reduce violence in the short term because they reduce child abuse, but they also reduce it in the long term as those young children grow up to be adults. And there are other programs, for instance, limiting access to alcohol, or if possible, limiting access to knives and guns, all reduce violence in the short term. While I'm a strong proponent of those programs that invest in young people and give us short-term results, a 50% reduction within 3 years, there are also programs that can be facilitated by policing. So problem-oriented policing in hotspots is one, but we don't really know the extent to which these provide permanent, sustainable reductions. We know that they reduce crime and violence in those areas. We also know that the American-focused deterrence program that pushes young men towards outreach services like youth inclusion or cure violence can be helpful. I'm a particular fan of the way that Scotland did this. I'm very nervous about the way that this is used in the United States because it focuses on young Black men who are disadvantaged. And yes, it pushes them towards positive things, but if they don't go towards positive things, then it returns to the American policing and incarceration strategies that are so harmful to those young men and their families and so harmful to communities over the long term. So we need to be careful about those. There's some interesting programs that are based on assistance to victims. I like the Navigators program in London, but I also like the programs in Canada and in the United States where outreach workers go to hospitals to work with the victims of violence, whether they're stabbing or handgun related or not using weapons. And that was, of course, one of the secrets of the Bogota strategy in the 90s that reduced violence over almost 10 years by 50% by focusing in hospitals, focusing on alcohol, focusing on guns. But Bogota was more than just those three strategies. It was the creation of a planning group reporting to the mayor to analyze, to do the epidemiology of what causes violence. And people who are fans of Cardiff know the Cardiff model, know how important it was more recently in England. But Bogota led to the Glasgow strategy. I was at the meeting of the World Health Organization Violence Prevention Alliance that heard about the success of the Bogota strategy from the guy who was the key, one of the key players in that planning group. And then Carnochan, a high-level detective from the police agency in Glasgow, said, well, I'm going to do that. And he hired a public health analyst, Karen McCluskey, and the two of them, after a couple of years, started to implement targeted strategies on the youth most involved in violence. And they achieved a 50% reduction over approximately 3 years. Now, Glasgow is not important just on its own. It's important because the Youth Violence Commission in the UK looked at what could be done about stabbings and youth violence more generally, and recommended 6 actions. And the top of their list was to clone the analysis strategy that was used in Glasgow. So we now have the Mayor of London, who in 2019 was re-elected on a tough on causes, tough on crime. And a key part of that tough on causes, tough on crime was the creation of a violence reduction unit headed by a very successful city councillor. And that program is to be watched by all of us. We can learn a lot. He is not only tackling the social determinants of poverty and racism, but he is also targeting mentoring and job creation towards the young men most likely to be involved in violence. And he also has navigators in hospital emergency rooms. And of course, London is just one of 17 or 18 strategies across the UK that are in part funded by the national government, and that's important in principle. I would like to see much greater funding, particularly of the strategies that need adequate and sustained funding. But importantly, also, it's part of an evaluation. And this gets overlooked. If you go back 40 years ago to Gilbert Bonmaison in France, he emphasized evaluation all the time. But of course, it didn't happen in France, and it hasn't happened in most other countries. Well, the United Kingdom is now doing it on a scale that will give us some important results. But it's not only the United Kingdom that is replicating something along the lines of Glasgow. We have the new mayor of Boston coming up with a promise to reduce shootings and homicide by 20% over the next 3 years. And one of the things she did was bring in Abt and his colleagues to help advise on at least one significant part of that strategy. Yes, there is a senior advisor to the mayor of Boston, but I like to see a real office for violence reduction with people with the skills who know what has worked and who know how to analyze data and who know how to guide smart investments on what works. I'm a fan at the moment of Newark, New Jersey, where the mayor has set up an office on violence prevention and trauma recovery. I like the combination of the two phrases, and made Newark an exception to the significant surges in homicides that happened across US cities between 2019 and 2020, and have subsided a little, but not too much. So let's talk just a little bit about Canada, in North America, a relatively low violence country. The city of Toronto, for instance, has only 10% of the homicides of Chicago. These are two cities of the same size. People want to move into Toronto. They want to move out of Chicago. But at the moment, they're approximately the same population, but Chicago has 13,000 police positions. Toronto has 5,500, and as you might expect, Chicago has an incarceration rate that for any other country across the world is just off the charts. An incarceration rate of roughly 6 times the rate for Ontario, where Toronto is situated. So we have some exciting things happening, the knowledge, and some cities doing some things, the UK government spreading it and using evaluation. And I think we can learn from this. But to come back to Canada, in 2019, province of Ontario, that's about 14 million people, changed their Police Act to require a community safety plan, actually a community safety and well-being plan. But within that plan, the idea was to reduce crime and victimization, both street crime, but also gender-based crime, and to do some other things that are in the well-being category, like reduce homelessness and deal with mental illness and those sorts of things. So it shouldn't be at the early stages, but it is at the early stages. Toronto has the beginnings of a plan. One highlight of the plan is referring mental health crises to mental health professionals instead of police. They're also studying, they spent $1 million studying a governance model for the reduction of violence, both gender-based and street violence. But more generally in Canada, there is a slow, typically Canadian movement, cautious movement. Put your feet just gently in the water. You don't dive in like Americans would do. And this change is about community safety well-being plans, really from coast to coast, and with, importantly, access to some very skilled trainers who work for the community, the Canadian Municipal Crime Prevention Network have developed a significant training program with real skills that I think can be adopted elsewhere. We also need tools, and we've worked on some community safety tools so that decision makers can check off whether they're doing the things that are known to work, and also looking at having the essentials like a planning group, like people who are trained. So within this context, I think it's also important to see the academic partnerships. I'm a big fan of the Icarus project with the European Forum on Urban Safety that has really looked at the last 30 years and begun to make recommendations for the next 30 years. I think we can learn a lot from their practical partnerships, talking about how to get real investment, smart investment, adequate and sustained investment in prevention to see real measurable reductions in street crime and to see real reductions in gender-based violence. Of course, those reductions in gender-based violence have to be measured by surveys. And the Americans and the Mexicans, by the way, are both very good at those surveys, but the rest of us are not. There's also a trend to see professorships, chairs in violence prevention. So APT now has a chair in violence prevention at the University of Maryland and is getting involved in partnerships with cities like Boston. And Boston, I think, is particularly interesting. We also see the University of Montreal in Canada being funded by the Quebec government to set up a professorship. So all of this means that it's an exciting time. But I think we really have to talk a lot more about accelerators to get the shift to the smart actions that will actually give us those significant reductions, as I say, halving violence in Western Europe, in North America, in Latin America, in Africa, and in other parts of the world. by 50% within 5 years. That's achievable. We know it from the evidence. We know it from the cities that have done it. And we know that there are a network of peace in our cities that are getting more cities to commit to that 50% reduction. But we also have to look at whether they're actually getting the training in place, the plans in place. So there are 3 accelerators for me. And the number one, above all, is to create a cohort of young people who, or not so young people, who are masters and mistresses of community safety and violence reduction planning. That means they need to get to know what has worked, that is just not filtering into decision makers' policies. It means that they have to get to know how offices for violence reduction, like in London, England, work, or how they've worked in Germany, or how, in my view, they have worked less well in France. So there's a real need for universities and colleges and organizations interested in violence prevention to set up those courses. A second important issue is we need to learn from Boston. Boston in the 90s reduced shootings and homicides significantly, and then they came back up. They had a police chief from a neighboring city who tried to do the same thing, and now they've got a very progressive and skilled mayor doing some of the right things. But we have to make sure that those are permanent. So those offices for violence reduction are really important, and so we need to make sure that they are put in place and that they're used, and the people working in them have the right skills. And we need them to be able to work with the reactive systems of policing and courts to do the things that are needed. The third thing is that we need more sustained and adequate funding, particularly to focus on where we can get and sustain those short-term reductions. So the programs like youth outreach, youth inclusion programs, the programs in hospitals, the programs that are cognitive behavioral that I mentioned earlier and I mentioned in my book, we need to make sure that there is funding for those. Now, some of that funding can also go to short-term strategies where police refer young men just starting and offending to agencies that can help them. There are examples in Canada, examples in England, and examples in other countries. The third area that needs funding in terms of adequate sustained funding are those that tackle the root causes, but governments are either doing or not doing those because of overall government policy. And yes, they like we see from Toronto's much lower violence rate to Chicago, when you have universal health care, when you have schools that are of quality for everybody, where you have a social welfare net, then we see violence control. So thank you for listening. I hope you'll go on my website, www.irvinwaller.org. I hope you'll follow me on Twitter, and I hope you'll get a hold of Science and Secrets for Ending Violent Crime. Good luck with your conference.